So with that, I'm going to ask Sarah to pass the mic. Do people have some questions that they would like to ask? See a question over here.
I'm here from the leadership team of the Workers' Center with a question. Is there any information about health and safety issues among the workforce? Things that might be considered by people looking for jobs in the field, but also simply the social aspect of what's happening to the workforce.
There is someone, actually, coincidentally, I just heard from 3 or 4 days ago about this very issue of worker health and how the workers are organizing. And this is actually an activist in Pennsylvania and also a former gas company employee who knows a lot of current and former gas company employees. And apparently, the gas company workers and former workers are organizing because they've become so sick and they're just sort of fed up with putting up with it. So enough have spoken out now over the years that they're forming a group. This is what I've heard. If you come up afterwards and give me your card or email, I will put you in contact with the person who knows about this organization. But that person could then put you on to more of what these people are doing. One thing I think I wanted to mention that I forgot to mention in my first slide on sentinels is if we look at animals as sentinels, we look at children as sentinels, certainly workers. Right there, for the human population, they're the ones that are getting the most exposed to all these chemicals and what's happening to them. I know that some of them are being seen in Pennsylvania, but I also know that some of them in Pennsylvania are crossing the border and going into West Virginia and being seen. So if we talk about epidemiological studies, say, done in Pennsylvania, where are those cases going to lie? They're gone. So that can be a hard one. And also I've heard that industry sometimes restricts which doctors they can go to. So there's all that involved. But certainly that's a great question, and please come up to me afterwards.
Just to add one minor thing to that is that I think one of the best studies on this so far has been done on worker health it was a NIOSH study that looked at the effects of sand. That's something we don't always think about. We always think about sand as something really nice at the beach, or in a child's sandbox. But sand is actually an extremely dangerous substance in the workforce or in the workplace, and these workers are exposed continually to sand in the air. They're breathing this in, and it's likely will be a cause of silicosis in the near future.
And I would add one thing, which is some of us are thinking about how do we reach out and help to educate people that aren't fractivists. And the workers, to me, are a group that, or the potential workers, the people in New York who are looking at this as, gee, this is a great way to get a job. I think it would be great if we could work with you, perhaps, to try to organize some kinds of meetings where some of the people from Pennsylvania might come up and talk about some of the health issues. So I'd be great. Another question.
On the one chart on alternative energy, the light gray area at the top, I couldn't read what that was growing into the future.
I think that was your slide, Adam, the one from the article about energy stuff. I don't know that we can bring it up. And maybe while technology is warming up here, there was a gentleman who wanted to make an announcement, and I gave him permission.
I'm Reverend James Boodley, and I'll phrase it into a question. What about religious issues and fracking? I'm good friends of a church down in Newark Valley, and we are having a workshop similar to this a week from yesterday on faith and fracking, pastoral concerns about gas drilling. I'll be next door. I've got some handouts. So religion and religious faith issues are also part of this. Thank you.
Yep, they are. Okay, here's the slide. So you were asking about the top.
net energy reduction achieved by converting from combustion to, what is that? Electricity supply. Wind.
Sunshine.
And energy efficiency.
Yeah.
So reducing demand by tightening up our houses and reducing energy use in all kinds of ways is this one.
This paper is actually available, where you can look at it. It's on the front page of the PSC website, and you'll be able to look at it yourself.
Great. Another question?
Yeah, I just wanted to respond real quickly to the first questionnaire, and then I have a question. That was a very good question, Teresa. Is that taken into effect by New York State, what the workers are going through? Because one of the several speakers that were up at Ithaca College talked about how the workers were not allowed to talk about, you know, their job. And also, when they had a health effect, they weren't sent to the local hospital. They were sent to the company's health doctor. So all this information is not being disclosed. So I wanted to, there's a lot.
Thank you.
Thanks to all the wonderful videotaping we've done, that's something simple everybody could go back and find out. What I wanted to ask is the slide with the water table, because I don't see that having come up very often. I find that very interesting, because that's very significant. And can you elaborate on that? How, like, let's say in New York State, the water table is more closer, because that's
Okay.
very important. Thank you.
So that was one of Robert's early slides. I don't know how easily we could bring that up.
I don't think we necessarily have to bring it up. We can just talk about it for a second. That was okay, so all I did there was to take a paper that was published by industry, and so I said, okay, this is about how deep, the extent of the shale in Tompkins County. So I just moved that curve up. And the aquifers that were at the top, they were Pennsylvania aquifers. But we know, some of those fractures would have come close to the surface, okay? So that's one thing. The other thing is, if you look at that paper, and it's not actually so easy for many people to get to. It's behind, you have to pay for it unless you're at Cornell. You can have access to Cornell or Ithaca College libraries. But if you can get to it, or if you want to see it, you can email me. I'll send you a copy. You'll see that there are really a lot of variation. We don't really know what the fractures would be like in Tompkins County. We don't know if they would extend that far. And because you can see in other shale plays, maybe they don't extend that far. The other thing they don't know is how accurate their data is. They guess that it has about a 20%, plus and minus 20%, but it could be bigger than that, it could be smaller than that. So this was mainly, my point was mainly to show that if we use their data in the Marcellus Shale and put their data up to where the shale layers are in New York State, or in Tompkins County rather, then the fractures could almost get to the surface and certainly, would hit the lake.
Thank you. Another question? Hold on, there's the mic.
When industry and many people that have signed leases look at the profit that they will make from the shale gas drilling, what in the long run is really going to be the impact, not only on the people, the animals, the land of the drilling, but the health impact on society, the cost? Will it, you look at it, the profit versus what it may end up costing society in the long run, and the short-sightedness that we seem to have in this country, rather than having the foresight. And of course, with the ACA coming in, what will the impact then be on premiums and the exchanges and all of those things, taking that into consideration?
That's an extremely important question. The word that's often used to describe it or sum it up is externalities. The externalities are all those costs, and they're not They're not being borne by the energy companies. They're not being asked to escrow a dime. The energy companies would never have been able to develop this technology if all of those protections weren't removed in 2005 under the Energy Policy Act. And as you say, this is the actual cost is almost imponderable, but likely to be large. The studies that we're looking at are looking at things which manifest themselves immediately. Things like respiratory problems or death, things which you can see, but things that cost can be very chronic. I have managed to refrain from talking about endocrine disrupting chemicals, which is something that I've given a lot of thought to. But the effects of those, which can be there in incredibly, those chemicals can be there in incredibly low concentrations, the effects can be 20 to 30 years later and completely difficult to recognize as being due to an exposure. We have examples where drugs, which are endocrine disrupting chemicals, have been given, for example, diethylstilbestrol to many women who are pregnant, and it took 20 to 30 years to recognize that the terrible effects of that exposure in DES daughters was due to that chemical. And yet there was a clear identity there. People were given that during pregnancy. Here we have all these different chemicals that are being put in the ground, many of which are not disclosed. And then we have everything coming up from the ground as well. Some of it's being inhaled, some of it's being swallowed. And being able to connect those dots is very difficult indeed. So the effect could be large. The effect of removing all that water from the hydrological cycle could be very large as well. And industry gets to make a large amount of profit and run.
Some more questions.
Okay. Could I just make one
sure.
minor comment? One person that has looked at this in some detail, not actually in many of the points that Adam brought up and many of the other economic factors, is Jeanette Barth, and she actually published a paper just recently in the journal New Solutions. It's freely available. It's public access, so you can go to that journal. It's the first issue of this year. And she has a very nice article in there.
It's referenced on the additional resources. Okay.
Hi, I think my name's Pat, and I think one of the keys is to get that 2005 loophole closed. But as someone who's been a first responder and worked in emergency rooms, employees are supposed to come with any kind of exposure with their MSD sheets, and first responders going to an emergency site. I worked in manufacturing. We had MSD sheets ready outside the building for any first responders. Why are we expecting our first responders to be exposed to unknown chemicals if there's an accident at the site? And I'm wondering if that could be a back door to get them to really say what chemicals they're putting in there. No? Oh, I'm sorry.
It's actually, they are required to, like any other industry, to post MSDS sheets. The problem is that proprietary chemicals are not listed on MSDS sheets. We've seen a number of
MSDS, for those of you who don't know, material safety data sheets, and they're a piece of paper that talks about some of the toxicity issues of some of the chemicals, but it's not exhaustive.
There's a paradigmic case which occurred in Colorado, which was the case of Kathy Baer, who was working in an emergency room there when a field worker came in who had been exposed to what was called OptiClean. That's what's on the MSDS, OptiClean. You'd think it's something you clean your glasses with. Within a week, she was in her own intensive care unit with liver failure, with lung failure. Fortunately, she survived. The physicians involved in the case could not get hold of the identity of the actual substances in OptiClean, so they had to guess when it came to how to treat her. They guessed benzene, as far as I can tell, which probably was in it. Anyhow, when she went to the Colorado Oil and Gas Commission to try and give evidence, the chair of that commission would not allow her to give testimony because the majority of people on that commission were from the oil and gas industry, including Halliburton, who said that they would withdraw from the state if they gave what was in there. So that's the paradigmic case, and it's you can read it in a famous medical journal called the Durango Herald.
And she was only exposed through, I mean, she was not directly exposed to the chemical.
His clothes.
Through the clothing of the worker who came in.
His clothes of the volatile chemicals. I just want to add to that, in our cases, because we examine all this documentation and records, we've looked through many MSDS sheets. And I'm shocked when I look at these, that OptiClean, they've got all these different names for these mixtures. So it's sort of like a recipe, where if you ask me for my favorite recipe for applesauce cake, and I'll say, well, you know what, I'm not going to give you all the ingredients, but I'll tell you sugar. Well, gosh, what are all the other recipes? So that's what this is sort of like. We've got several in our cases where we only know what 10% of those chemicals are. The other 90% are unknown, and this is supposed to be okay. This is what it came down to, what the health workers even had to work with and struggle to get that information. But this is what's available even in legal documentation, that cases that are in litigation right now, in the cases that we have from health records, that's what our information is on chemicals.
Let me just say that this isn't just the gas drilling or the oil and gas industry that does this. I don't know how many people have read this book, Tom's River. It's about Ciba-Geigy poisoning the water in Tom's River, New Jersey, and there was a huge cancer cluster case there that was linked to the contamination. And what the company did was to pump water in addition to poisoning their aquifer, they pumped water into the ocean. And one of the things they said when they were asked about what was in their pipeline, they said, oh, it's 99% water and only 1% some other stuff. And I don't know if anybody is familiar with this industry saying something like that. And then when asked what was in that 1%, they said, oh, well, we can't tell you. It's proprietary.
Right.
So it's not just the oil and gas companies.
Another question back there.
Okay. I'm John. I'm from Newfield. And one thing I think about as a sportsman is the health of the fish in the game in the areas that I hunt and fish, primarily hunt. And I know people have been reported to not hunt in the Pennsylvania area anymore, and my neighbor goes down there and he hunts in that area anyway. I really don't want to eat anything that I take in an area that, has been affected or potentially affected by this process. Are there any studies out there that you know of wildlife, fish and game? Well, I guess I'll just let you answer that.
And actually, before Michelle answers, I think that's a great question, because some of us think of deer as nice organic meat. And because of the brine, because of the saltiness, I gather that animals are attracted actually to the ponds of wastewater because they're salty.
If I can, that's correct. And I saw a USGS presentation on the aquifers in Newfield, and the gentleman from the USGS service showed slides from around the county, and I believe there's one that is a historical marker. It says this creek was called Deer Lick or something, and his assertion was, there could be a fissure down to a layer of salt, and that's what attracts the animals.
Okay.
Right, so I guess I'll start off with saying that Penn State, so there are some people at Penn State that are doing some wildlife research. I don't know if anybody's in the audience. I know Sandy Paducah. I don't know if she's still here or not. But there are some people at Penn State that are starting to do, looking at how wildlife is affected. I know one paper that came out, what was it, like a year and a half ago or so, was saying that because the habitat was broken up, that deer sometimes like that, and that this could be a favorable thing. So I think it all depends how you word your research question and what you're looking at. If you look at deer getting trapped in a wastewater impoundment and drowning, maybe that's not so good for wildlife. And we do have that in several cases where deer and fox have gotten into reserve pits, drilling mud pits and wastewater impoundments and not been able to get out. Certainly lots of birds that happens to too. They'll get through the netting and the fencing and just get to that. So that's one issue. This food safety issue you mentioned, we have a case in Pennsylvania. Let me step back and say that a lot of these people, when we ask about how their animals are, their companion animals and their food production animals, they will also say, well, how about if I tell you about our wildlife? Let me tell you about the changes we've seen in wildlife. So we do collect that information, but because I don't have health records on that sort of thing, I have not really included that in the study. That's the least well documented of all the things that we've gotten. But let me step back to that case in Pennsylvania. It was a large well pad. There was drilling going on there. It's sort of stopped now. They're waiting for the price of gas to go up, we think. But when that pad was active and the wastewater impoundment was open, deer were up on the pad all the time. The farmers owned a lot of acreage, and they always had hunters in years before the pad came on their property, come on their property and go for deer. And they were very happy with that. So when the hunters asked to come again, they warned them and told them that the deer are around the wastewater impoundment a lot and they're probably drinking it, so just be careful. Those hunters actually ended up getting 2 deer that season and becoming very ill. They did mention to the woman that their animals, their dogs and cats, would not eat what they usually eat of the deer cuttings or entrails. The animals didn't eat it, but the people did and became very ill. So I mean, that I think is a cautionary tale that if the deer are getting at this drilling muds, pits, and wastewater impoundment sort of thing and actually taking it in, they could become, shoot them, they could look okay and make you very ill. But there are no studies on that I know of.
Hi there, my name is Mike, and I have a question regarding some of the dairy herds. I don't know if any of you have seen the presentation by in our fracking group, we call them the 2 Carols, the ladies from Pennsylvania. And one of the shocking things that one of them said at a presentation that I heard, she's an organic dairy farmer, and she contacted the company that she supplies, and because she was concerned because some of her animals were sick because of some contaminated water. Right. And they blew her off. They did not want to hear about it. And so my question is, in terms of general public knowledge, wouldn't it help if we could start putting some names? She named the company, which is Horizon Organics. And that shocked me, and it made me go home and look at the numbers on our milk containers, because I have kids, and to see where our milk was being supplied from, and luckily it wasn't Pennsylvania.
Right.
But I think it's something that maybe if we start putting names of companies with some of these potential contaminations, that might be one more lever public relations wise.
I think that, so far from what I know, and maybe Robert and Adam could add to this, I haven't heard of any organic certifiers or companies that produce organic products actually coming out and saying, we're not taking milk from these states that are intensively drilled. I haven't heard that. I haven't heard that at all. Maybe somebody who's here from or knows about NOFA, the New York Organic Farmers Association. I think that they're my understanding is they're sort of tackling it and thinking about it right now, but I don't know if they've come up with any.
Can you hold on, Sarah? Can you give him a mic?
NOFA has gone on record against fracking, completely and unalterably. The real issue here is the National Organic Standards Board. They have no comment or regulations with respect to fracking chemicals getting into anything.
Right, and so I think that's the sort of thing that really has to happen. People have to start getting involved with this. But it is a tough question. And when you go into the supermarket, those questions that I asked about food safety, are you going to think twice if you know where something's come from, especially if you know it's from an intensively drilled area? You might think twice. I think on one of the slides now I'm remembering, I forgot to point out, it was my last slide, and there were 2 production water tanks there. That slide was taken in an area of Pennsylvania, and there were cornfields and squash growing all around that. The vent on top of one of those tanks, cap was open and it was venting into the air there. What does that mean for the corn and the squash that were growing in those fields? We saw many of these well pads are right in the middle of farms. And that one picture that I had up there, the new silo, and that's on the special edition, was really meant to make a point that they're making the farmland industrial. They really are. They're so close, and they're right in the middle of the farmland. And it really makes you think, how safe is my food?
And so another question then that occurred to me was, along the Pennsylvania-New York border, the southern tier, how far do the air effects extend? Because I've wondered, we're only 60 miles away, and when there are thousands of drill pads down in Pennsylvania, could our air here even be affected? Or if not here, the southern tier?
You know, I've heard Sandra Steingraber talk about this, and it was about in our Ulysses, one of our Ulysses presentations, and I'm remembering what she said, that it could go pretty far. She was looking at effects of ozone and looking at effects of asthma rates, and that's the sort of thing that Sandra Steingraber would know. So I can't answer that specifically, but I'm remembering that those effects, those things would affect us.
And often one of the things about air pollution is it may actually not be right next door. It may be traveling a distance before it comes down too. It depends on the air patterns. It's hard to study. Another question?
Hi, my name is John. It seems like in general that European countries have, higher standards in terms of regulations, and also in requiring, disclosures of chemicals. And, I believe France and I think Norway and other countries in Europe have already banned fracking. Do they just do that because they're smart, or do they actually have data that they could share? I mean, do other countries have data that we lack in terms of, because they required companies to disclose chemicals?
That's a good question, John.
Well, one of the things in Europe is that the precautionary principle is not a dirty word. It's something that they take very seriously, and I think that's, I'm sure the reality is much more complex than that, but they certainly look at it in a different way than we do in some of those countries.
And I think it's a little hard to generalize, because I think in England, it's go right ahead and frack.
And in Ireland as well. What was I going to say?
And I don't know, it may be that in France, sort of like in Vermont, there isn't shale gas, so it's kind of easy to say we don't want it. Yeah. And at least in the work I've done in other environmental arenas, Northern European countries tend to be more cautionary than some of the Southern European countries. And part of it is also population density, that people are closely packed. And, we've got Colorado and Wyoming and wide open spaces. Now, I think one of the reasons that fracking has become as much of an issue as it has is that it's coming to our densely populated, highly educated area.
Let me tell you about an initiative. PSE, the organization which I'm a co-founder of, are working together with the London School of Hygiene and Tropical Medicine, and we're putting on a conference in December there, in which we're bringing over scientific expertise from the United States, where most of the fracking and drilling has happened. And they're bringing together scientists, policymakers, media. And this is going to be something that's going to be a dialogue. So directly, the sorts of conversations that we're having are going to be happening internationally. We don't conceive of our group as just being a local New York group. In fact, our director, our executive director, is in Berkeley, California. The chart I showed you at the end was by one of our board members who's at Stanford. And we've got advisors now in European countries. So I think that we have to think locally, but these conversations are happening globally. And the stealth way in which the drilling companies enter new states, new communities, and people haven't heard about it, that's over. I think that at this point, we're getting this across. Having said that, I heard recently that Russia is now investing largely in trying to get into this gas boom as well. So I think that we've definitely got a hard schlep ahead internationally.
I wanted to ask you to say something short and pithy, a catchphrase about risk, because Mike and I have to go back and summarize this forum for a very unsympathetic audience. When I was busy flunking out of science class as a freshman, I think we used to say, absence of evidence is not evidence of absence, and think that we were being very clever. But it's really hard. It's really hard to get across the idea of risk to people who are not scientists and who aren't, used to thinking that way. So can you say something that we can take back?
Who are you going to be talking to?
I think that I'd like to say that risk analysis is not unique to epidemiology and to those kinds of questions. It's in all kinds of other areas of public life. It's its own area of study. There are over 20 faculty members at Cornell University who study risk analysis. Risk perception varies, and we all know that in ourselves. We may be frightened about going on aircrafts, but we're quite happy to drive. It's very difficult to communicate risk. I think that what we can say, though, is that we know a lot of the risks that are involved from the kinds of measurements. We don't have to, if we know that in Wyoming, for example, the levels of ozone in the ground level ozone, tropospheric ozone are higher than that in the center of Los Angeles, we know all the data about how toxic that is. We can directly look at that. We don't have to rediscover the wheel and look at it in terms of an epidemiological study. The epidemiological studies have to occur because we don't know the effect of the aggregate effect of all of this on people. But coming back to that, it is very difficult to discuss risk. Risk is often where epidemiological studies feed into, and it's risk that's then communicated to policymakers. So I think it's extremely difficult to communicate this.
I think I would just like to add to that that I think when I had that slide up there of the data gaps, there were so many things that were missing. It's really hard to even predict what the exact risk would be. We're not even to that point yet of knowing what the risk will be, and I think that's the problem. We have so much missing information. We can't even say, is this safe or not? We can't even say that at this point. We're just at that bottom line of filling in these gaps and then moving forward with studies. So that's where we are. If somebody says, well, tell me about the risk, you say, well, we don't know what the risk is. There's so much missing information. So I think go back to that slide that I talked about, go back to what Adam had said too. There's all of these data gaps that are huge, where we can't even predict accurately what the health effects are going to be. For instance, with the MCLs, that is so basic. That's our national drinking water standard. How much more basic can you get? We have several cases that I refer to that are in this EPA study. There were several semi-volatile and volatile chemicals that were detected in their water chemicals without MCLs. These people were told their water was safe to drink. What does that mean? The detects were there, but there were no MCLs. That's an example. What's their risk? We don't know. There's no MCL. We don't even have that information. One of the chemicals on one of the cases was 2BE. And that chemical is a major chemical that's used in drilling fluids. It's in over 100 products. That's 2-butoxyethanol. That's a glycol. And that's an area that in the EPA, that group of chemicals, it's still under development, that they're working out how to test for it. So if we talk about basics, we don't even have the basic information yet to make a sound decision. That's a huge risk. So,
One of the things that I think is very problematic is people tend to believe sources that say whatever it is that they believe. And I think it's very hard with people who think, these stories. I was in line waiting to go into a hearing. There was a woman behind me with a drill baby drill button, and she looked kind of like me, so I asked her, I said, looks like we have very different views of this, and I'm just curious, what do you make of the water pollution cases? And she said, oh, they're made up. So she simply doesn't believe what she doesn't want to believe. So I think to get into sophisticated arguments about risks is going to be hard with people because they're not going to want to believe it. One of the things that I think we should be talking about is right now the price of gas is very low. The gas has been in the ground for 300 million years. It's not going anywhere unless we frack it. And it's likely, if we don't follow the energy path that I hope we do follow, that Adam was talking about, someday that gas could be very valuable. So why take these risks? Why gamble with our health and with our economics, as somebody was saying? Economically, this is not a good scene. For those of us with gas leases, the royalties are a joke at this point, if anything, because a lot of the leases basically say you only get royalties when the gas company has subtracted all its costs. So maybe that's another way to do it, that going head on and saying health is at risk, and they're going to say, no, it's not, they're making it up. Maybe an argument is, let's leave it there for a while and let things settle out. So, another question?
Hi. My question was about MCLs, and the question is basically, how are these MCLs determined, and is it determined through like animal testing, or could it possibly be determined through one of these involuntary human experiments like Pennsylvania or Wyoming or Colorado? And if either of those are true or both, what does that say about our kind of like system of, what does it say about the ethics of science? Thank you.
And actually, before we go on, I just wanted to make sure that everybody kind of understands that basically the MCLs are federal standards. There can also be state standards. State standards always have to be as strict as federal standards. And those are, in theory, calculations based on peer-reviewed science studies. And those studies might be of workers and their exposure, or they might be trials with animal testing. And then this maximum contaminant level is set, and the federal government decides what level of risk is okay. And when I was working in this area, the level of risk that was decided to be okay was, in this case, one excess for cancer causing, one excess cancer in 1 million people was considered where you'd set the MCL. I don't know where it is today. But there are not MCLs for a lot of things, and that's partly because it takes a very long time and a lot of money to get them in place, and it's also because we don't know about many of these chemicals. Anybody want to add to that?
Well, you were talking about ethics of science. I'm not sure where you were coming from there. But I think, MCLs are a good thing. I mean, we need to have some understanding of where toxicity occurs. The problem is that we don't know enough. We don't know, a lot of the effects of a lot of the chemicals that are used. We don't know the effects of combinations. We don't know the effects of low doses sometimes. So I think, science tries to be, I'm not sure if you're referring to animal studies there.
Can I just answer really
quickly? Okay, yeah.
Because my thing is that what if I'm understanding your presentation correctly, science cannot say definitively whether one of these mystery chemicals is toxic or not until we kill a bunch of animals. Or perform an involuntary experiment like in Pennsylvania and watch people get sick.
And even then, we're not isolating individual chemicals, so it's not going to help us set an MCL for them. So, do we have one last question, or are we?
Hi, my name is Kathy. I actually teach environmental ethics, and one of the strongest arguments against the precautionary approach is the idea that, well, in order to have progress, you've got to have risk. If we were willing to take risk, we never would have used the fire that we discovered. And so I think that when I talk with my students about a technocratic approach which emphasizes cost-benefit analysis and a utilitarian approach where we're looking basically for the resources that the environment has to benefit us humans, and where the benefit of the doubt lies with the companies that provide the data that we're just supposed to believe, and right? But it's really, when you get down to it, I have to say that I think it's a very deep philosophical question where we have to look at our philosophy of life in the United States. Many of us are used to taking risks. We do sort of frail cost-benefit analyses when we decide whether we're going to go and drive on a snowy day or something, right? So cost-benefit analyses are not, foreign to people in their everyday life. But when we really have to look at the question of progress and what do we really mean by progress, we have to look at how we have to get into a post-carbon society. And also, just face that question right on. Because I think that quantifying risk and all is one thing. That's the sort of technocratic approach. But if we look at a progressive approach, we've got to say, we're in trouble. And there's these carbon fuels that are damaging on our lives. And even though we're used to living with risk and we want progress and all, and yay, America, what kind of life do we really want to live, and what kind of life do we want to give to our children and our grandchildren? And this notion of progress does not justify the rape and pillage of the environment. So we got to question these basic values, but that's a philosopher talking.
I appreciate that. I think that's a great way for us to end this. So thanks. Hold on one second. We have something Sarah needs to announce.
Hi, you may have picked up one of these, and if you didn't, I'd ask you to look for one before you leave. If this is an issue that you care about and you'd like a chance to tell our legislators in Albany, the Senate, that they should pass a 2-year moratorium, or your assembly person that they should pass a solar bill for our state, hop on the bus. Next Tuesday, the 23rd, going from Wegmans, from Caroline, from Whitney Point, hop on the bus, join us for a day of lobbying in Albany. Thank you.
And I think you also probably all know about a conference taking place Friday, Saturday, maybe parts of Sunday, that Barbara Lifton, and Thursday, kickoff is Thursday night. I think the Sustainable Tompkins website would have information on that. And with that, I'd like to again thank our speakers. Thank you so much. Shannon has some of them.